screen going. Okay, are you guys seeing the full slides or the speaker notes?
We're seeing full slides, but the Zoom controls covering the top.
Yeah, okay, I'll hide that. Okay. There we go. Okay, does that look okay?
Yes, sounds good.
Okay, and sorry, I apologize. I can't see any of you on the screen anymore once I'm sharing my screen. So just feel free to interrupt me verbally if if there's anything you need to raise. So yeah, thanks again, Sadia, for inviting us to share our paper. And I'd like to acknowledge, I see Marianne Shantz is on the call. She's one of the co-authors on this paper and was instrumental in completing this work, and also Miranda Manning and Louise Kashuba. Yeah, so as Sadia mentioned, I'm with University of Calgary, but this I've also been supporting Covenant Health Palliative Institute over the last several years now on a couple of projects related to raising public awareness of palliative care and advanced care planning. And so this paper that we're talking about today is out of that work. So yeah, just as a little bit of background, yeah, as I mentioned, this work came out of a multi-year, multi-sector palliative care public awareness initiative that the Covenant Health Palliative Institute embarked on in about late 2020 with funding from the government of Alberta. And the purpose, or I guess the mandate of that initiative, was to increase public understanding of palliative care through resources developed for use in Alberta in partnership with community stakeholders. So really trying to improve not just awareness, but also good understanding of palliative care. And so why do this in the first place? Why did we embark on this project? Why did we think it was important to raise public awareness of palliative care? We know from extensive research evidence that there's lots of misconceptions around palliative care. It's quite often poorly understood, not just by the public, but also by many clinicians. We know that many clinicians are sometimes hesitant to raise the topic of palliative care with their patients. They worry about upsetting them. And on the flip side, we know that palliative care can be a term that people can find scary. And so as a result, we know that many people who could really benefit from palliative care often receive it too late or even not at all. And so that's the impetus behind this work. So we started very early on in our project by doing a literature review and an environmental scan to try to see if there were any tools already out there that we could leverage for this project. We were looking for tools that could help increase public understanding of palliative care amongst the general public. So yeah, you can see our criteria on the right for identifying tools was obviously something for a public audience, ideally something that was free or very low cost. We wanted something that was easy for people to access so they could access it, in the community essentially from anywhere. And obviously something that educates about palliative care, and also something that was I guess engaging, right? Something that promotes active engagement. So as opposed to something maybe more static like a website or like a handout or something. And we found that there really wasn't a lot out there in terms of education for the public. There's lots of tools and resources for healthcare providers, but there really wasn't anything locally in Alberta or even nationally for the public. We did come across this tool that we quite liked from the All Ireland Institute of Hospice and Palliative Care. This is an online module that they had developed called What is Palliative Care? We quite liked it. It was relatively short to go through. I think it was maybe about 30 minutes to go through the whole thing. It was geared. It was for the general public. It used plain language. It was interactive. It featured a number of short video clips with caregivers as well as clinicians. But as you can imagine, it was quite focused on, or quite specific to Ireland. So we were referring to this as our inspiration for the tool that we ended up developing. And so, yeah, so we decided to use the Irish module as a starting point, and we put together a working group to advise us on adapting or developing a tool for use in Alberta. Our working group had a number of palliative care clinicians, so content experts. We had palliative care physicians, nurses, and social worker. We also had a public advisor who was part of our public panel with the Covenant Health Palliative Institute that was put together to advise on these public awareness projects. Marianne Shantz and I were part of that working group. And then we also had an instructional designer who was responsible for doing the heavy lifting and drafting the module. So our working group met 4 times between May and June of 2022, and we had very specific agenda items, topics to get through at each of these working group meetings so that we could be most efficient with people's time. And then Miranda spent the summer and the fall. She was our instructional designer. She spent the summer and fall of 2022 drafting the module, which we then shared back with our working group. A draft was shared with our working group in December to get their feedback. We recorded 3 interviews with either patients or family members of people who had experienced palliative care and incorporated those into the module. And then the close to final version of the module was reviewed by our public panel in February, and the tool was launched in May of 2023. So it's been out there for a couple of years now. And yeah, so this slide is showing, I guess, sort of the main points or considerations that our working group really encouraged us to focus on. So obviously, with this being geared towards a public audience, they really encouraged us to use plain language, no medical jargon, easy to understand. And something that we talked about, maybe debated a little bit more at length, was around whether we went with kind of like a myth-busting approach that we've seen other tools use. And I think the Irish module followed that format. And we decided in the end to not use that format, but instead to just present positive messages. We didn't want to, give airtime to myths that, people may inadvertently focus on or remember rather than, what you do want them to remember. And as much as we wanted to tell people everything, that we thought they should know about palliative care, our working group advised us to focus on, a smaller number of really key messages that we wanted people to take away. That we should strive as much as possible to emphasize diversity within the module. So diversity of ages and genders and racial, cultural identity, as well as disease types, illnesses, and settings of care. And then finally, this was really important to our working group. They really wanted us to try as much as possible to find some real Albertans, so people who had benefited from palliative care, who we could feature in the module, so we could get a bit of their story and share it with people as a way to help people connect with the topic. So I will turn over to Bill, and he is going to talk a little bit about how we incorporated patient and family caregiver perspectives.
Awesome. Yeah, we'll just go to the next slide here. Yeah, so there were 3 kind of Albertans that were identified. I'm one of them. And so there's 1 patient and 2 family caregivers of diverse ages. So I'm just going to go through kind of my life experiences. So I was in high school at the time, and I was caring for my mom who was going through a life-limiting illness. And that's when I accessed palliative care for my mother. So I was my primary caregiver for my mom, who received palliative care for her cirrhosis of the liver. And there was Colleen, she received palliative home care for advanced cancer. And Sarah, who was the primary caregiver for her husband, who received palliative care for advanced cancer as well. So there's kind of variety of different age groups and also backgrounds, as well as the actual disease in itself. So the um, the interviews were filmed as well, and our voices were incorporated in the actual toolkit. Sarah chose to participate anonymously, so they did not present on camera in the module itself. Yeah, go to the next slide. So we developed an interview guide to explore the holistic support provided by palliative care. But paraphrasing here, but these are the sort of questions that we have asked. So particularly going through different domains, how the palliative care can help with the physical symptoms, for emotional coping, spiritual questions or concerns, and social impact. Like for myself, I really emphasize on the importance of palliative care that focus on quality of life. I think when we transitioned to palliative care, the team was really asking about what does my mom and the rest of the family want to focus on. And it wasn't necessarily we're giving up on the treatment options, but it's also really incorporating how do we build hope into that kind of um, disease process as well. And we also finished the interview by asking everyone, what do you think everyone should know about palliative care? And I think that was a very inspirational video at the end that kind of combined everyone's perspective about palliative care. And we'll go to the next slide. And so, I mean, from this one, this is kind of my own voice in the paper itself. So traditionally, medical professionals have led public education on healthcare topics due to their recognized expertise. However, individuals with lived experience provide unique insights that have been shown to enhance educational outcomes. Despite these benefits, educational resources on palliative care rarely integrate the perspectives of those who have directly access to these services, which perpetuates a gap in representation. Therefore, inclusion in people with lived experiences foster those trust and engagement in educational materials. And also including voices from underrepresented groups not only address the gap in representation, but also helps to build rapport and trust with viewers by presenting relatable real world experiences. I think one of the key topic there is that, palliative care can be accessed by various different age groups. It's not just accessed by older adults. And I think having my voice represented in this toolkit really kind of emphasized that. And also just the fact that, we're coming from different ethnic backgrounds and cultural backgrounds as well. And having my voice is representing this was really meaningful to be there as well. Yeah. I'll pass it off to you, Trish.
Thanks, Bill. Yeah, as you can tell, Bill was a huge asset to this undertaking. Bill was one of our public advisors with the Covenant Health Palliative Institute throughout our public awareness initiatives. And obviously because of his own personal experience caring for his mom, we were so fortunate that he also volunteered to be featured in the module. So, and helped us write up this paper. So thanks again so much, Bill, for your role in this. So just we thought kind of for the rest of the presentation, you might be interested to see what the actual module is like. So we thought we'd give you some snippets of the actual module. So this is sort of the landing page for the module. Again, it's called Understanding Palliative Care. It starts with a very, what we hope is a very simple, plain language definition of palliative care. So, which is palliative care helps relieve the symptoms and stress of living with a serious illness. We also brought in this umbrella imagery, which you'll see here and throughout the module. And this is a nod to an editorial that was written by Camilla Zimmerman and Jean Matthews a few years ago, which was called Palliative Care is the Umbrella, Not the Rain. And so we like that metaphor to portray palliative care like an umbrella that helps provide relief to people. It's not the rain or the storm itself. So this is how the module starts. And then the heart of the module really focuses on the holistic support that palliative care can provide people. So how palliative care can support people with physical, emotional, social, and spiritual well-being. And so if you click on each of these plus symbols, these domains, it'll take you to more information where the module describes some of the professional supports by healthcare professionals that can be provided to support each of these domains. And it also, each of these sections also features a personal story from one of either Bill or Colleen or Sarah, speaking a little bit more to how palliative care helped them in this area. And then, as Bill mentioned, at the end of our interviews, we asked all three of our interviewees, what do you wish more people knew about palliative care? And we got some really, really rich, lovely answers. And so we decided to combine those into a short video. So we would like to share that with you now. Whoops. Oops. Sorry. Somehow I have clicked on the pointer. Okay, here we go.
Palliative care still includes intervention. We're not stopping all medical efforts. It is not a giving up on someone. It's doing what's best for her.
I think that's the big misconception about palliative care. As soon as they hear that phrase, they think that the end is near and it's a negative thing. And I thought, in fact, I see it as a positive because they're to improve my quality of life. It makes your life so much easier during an incredibly stressful time.
Families can self-refer to palliative home care. I wished we could have had this implemented earlier. At least we would have been connected to palliative care nurses who could have helped us navigate, to help make decisions, to help prepare for the next phases.
Palliative care looks at a person holistically and creates that plan that's very catered to that individual, because it really asks critical questions for the patient and their family members. What is your top value that you want to maintain? And palliative care really, really gave that decision to us as family members and patients.
Implementing palliative care early on any life-limiting illness journey would provide so much support, resources, and in the end, improve the quality of life and reduce pain, suffering, and anxiety for both the patient and the family.
Yeah, so that's a bit of a peek at the modules. So I guess just to wrap up here, we feel like the Understanding Palliative Care module fills an important gap in Alberta. As I mentioned, we were unable to find any other sort of a resource that was evidence-based and public-facing to improve public awareness and understanding of palliative care. And we hope that by featuring Albertans who've had lived experience with palliative care, that this can allow users to connect better and better understand the benefits of palliative care. So I think, you know what, I'm just going to throw up this slide. Just that's my email, pbiondo@ucalgary.ca. If anyone has any questions, you're more than welcome to reach out. There's also the email for the Palliative Institute, and then the website at the bottom is our Compassionate Alberta website, which is where the module is housed, and a number of other tools related to our public awareness initiatives. So I think I'm gonna, if it's okay with you, Sadie, I'm gonna stop sharing so I can see the screen.